Thank you once again for joining us this morning. Welcome to the Zimbabwe Merck Foundation Annual Summit 2021. I would like to absolutely recommend you for taking off time to be with us. Of course, this online video conference is co-chaired by the First Lady of Zimbabwe, and in a few minutes I'll be welcoming our very, very important guests. My name is Brian Mulondo. Thank you so much once again for joining me. I am speaking to you live from Uganda, the Pearl of Africa. Please remember that this video conference is also being live streamed.
Thank you very much, Brian. Thank you, everyone. First of all, I would like to address my greeting to Her Excellency, the First Lady of Zimbabwe, Madame Oxilla Mnangagwa, the Ambassador of Merck More Than a Mother, and our long-term partner, and also, of course, the representative from Ministry of Health of Zimbabwe, and all our alumni who I'm very proud of them. From Zimbabwe, we have almost 100 alumni, either from the healthcare providers who got the scholarship of our training, or the media representative who also won Merck Foundation awards to be the champion of social and health champion to raise awareness and sensitize communities. So imagine this number of specialties when they graduate, what type of impact they were going to give. That's why me and Her Excellency, the First Lady of Zimbabwe, we are working around the clock with messaging on WhatsApp and calls and emails, and to make sure that we select the right candidate being interviewed to measure their eligibility. And then this has to be communicated to the universities. And we're talking about 1 year and 2 year master degree, 1 year diploma and 2 year master degree in all these specialties. In UK universities, either Cardiff University, Edinburgh University, or Queen's University, or South Wales University. So it's a very high level education that you're going to have. It will have impact on your career and your skills and knowledge on personal level, but also on your community where you are going to practice after this. Amazing. And there's no doubt this will be a transformation, a revolution transformation in public healthcare and in patient care, and the results will show, and we are all will be part of the legacy of Africa. But we are not only focusing on this, but we also focus on our dear partners, very important role of media. Media, we believe strongly that media can add great value to Africa communities and sensitize the communities about health and cultural issues that it is needed to be corrected or needed to be changed or emphasized on if it is okay. So, for example, like supporting girls' education, like breaking the stigma of infertility through our Merck More Than a Mother campaign, or raise awareness about coronavirus, or raise awareness about any other disease like diabetes and hypertension and all the lifestyle diseases that we need to educate the community about it, so they can prevent it or early diagnose it, and then save a lot of resources with the media. That's why we had our media training, and we are going to launch this frequently every year. To train media how to report these cases, how to make the change in the culture shift, how to be the voice of the voiceless, how to be the champions. And of course, through our award also, which we are doing frequently every year. We have 2 awards for media. It's the Major Commission Award for Merck More Than a Mother, to break the stigma of infertility and empower girls in education, and the Mask Up with Care and Before Stay at Home award to raise awareness about coronavirus, which is very important, an emergency global pandemic.
I'm very happy today to join you at our first annual summit of our long-term partner Merck Foundation and my beloved country Zimbabwe to follow up and discuss our joint capacity building and development programs that aim for the first time to transform the landscape of patient care and make a history in Zimbabwe. Above all, to meet and acknowledge all of you, more than 100% of Merck Foundation alumni from healthcare providers and media representatives who won the scholarships of medical training in underserved and critical specialties or won media recognition awards in raising awareness about health and social issues in our communities. Therefore, I would like to welcome you all. 85 of our doctors, the future healthcare experts, who have either already graduated or undergoing or will join soon Merck Foundation scholarships of specialty training in critical and underserved specialties. And to also meet the 15 winners of all Merck Foundation Media Recognition Awards, who are our health and social community championships, to break infertility stigma and raise awareness about other health and social issues, such as girl education and the ongoing coronavirus. I am proud of each of one of you. Keep up the good work.
Thank you very much, Excellency, the First Lady of Zimbabwe and Ambassador of Merck More Than a Mother. This great impact is due to your dedicated and continuous follow-up support. The investment the Merck Foundation is doing in Zimbabwe is huge. It's around the scholarship can arise to 1 million euro. So this could have actually contribute and will contribute dramatically to the quality and accessibility of patient care for all Zimbabweans. And of course, we will not be able to do that without the serious local partnership with Her Excellency, the First Lady of Zimbabwe Office and the Ministry of Health, who is selecting the candidates and the doctors and following up to make sure that they are on the right track in the study, because it's a great opportunity. And I want to emphasize here for everyone who's attending here who get this scholarship. This scholarship costs a lot, and no one, even me, would not be able to do it by themselves on their own expenses. It has to be funded by a foundation or an organization. So I really ask you from the bottom of my heart to take it seriously, dedicate the time, because this is one-time life opportunity. It will never be repeated. To have a scholarship in the UK university or Spain university, it is really something that all of us was aspiring for at a point of time during our young years.
I would like to start by thanking our First Lady and also the Merck Foundation for this opportunity to enhance my training in reproductive medicine. I also happen to be one of the first Zimbabwean doctors to benefit from the Merck Foundation scholarships. Like he has already said, I underwent a 3 months training in India at a hospital called Milan Fertility Center. It's actually one of the best fertility clinics or hospitals in India. So the training really covered almost everything, right from simple evaluation and treatment of infertility patients to advanced reproduction technology as in IVF and ICSI. That was in 2019. So, like he has also said, I've also enrolled in the diploma in sexual and reproductive medicine with the University of South Wales. So what this training does for us is that it really enhances one's understanding of reproductive medicine. So it increases your confidence when you're dealing with patients that are suffering from these problems.
So this program has also benefited me technically. I'm currently offering definitive semen analysis for the diagnosis of male infertility at my institution. I am still hoping and planning to extend the fertility services to a stage of offering cheap and affordable fertility solutions and options in the public sector through engagement of our government. This will have an impact on the society at large, since the services are usually more affordable in government institutions as compared to the private sector. Moreover, the society will also benefit through breaking the infertility stigmatization by making it possible for couples with fertility problems to have children, which is something of value in our local communities. Thank you.
Hello everyone. Good afternoon. My name is Dr. Alice Mulema. I'm a government medical officer at Nyanga District Hospital, and I'm an alumni management class of 2019. And I'm grateful to Merck Foundation for this opportunity to study. From my studies, one important thing that I learned amongst every other thing is the importance of diabetic education. Knowing very well that 99% of the time, a patient with diabetes is self-managing without the input of a clinician or a diabetologist. They're at home on their own. So it is therefore important to give them as much information as possible. And from the time I completed my studies, I do not just prescribe drugs, but I take my time to talk to the patient, listen to their challenges, and then give them the education that they require so that they have control over their lifestyle, over their condition, and this improves clinical output. And when patients come, usually they come with a caregiver, their family, and as we give this education, it is also an awareness to the families and to the community. Because of the knowledge that I received through my training, patient management has improved, and referrals from the district hospital, which is in the rural area, to the provincial hospital have lessened, and this has taken away the burden of traveling costs and accommodation costs from the patients. Consultants are happy to help me in manage patient remotely while the patients remains under my care.
So I'm really grateful to the Madam President of the country, Mrs. Mnangagwa, and also to Merck Foundation for this wonderful opportunity, especially particularly in this COVID era. It has really been helpful, and really knowing how to manage acutely these medical emergencies has been quite helpful, particularly for us who are in the internal medicine department. It has been a great pleasure. I'm really grateful for this opportunity.
I enrolled for the diabetes master course last year in 2020, which I managed to complete. It was a 10-week course which covered various aspects of diabetes, from the causes, the presentation, the various treatment options, the complications. So it really helped me. Also knowing the different kind of treatment options that are coming up. Medicine is always evolving. There are always going to be new things that come up. It's just unfortunate that at times in the public sector, some of these options are not going to be available. Even in private, it's not going to be easily available as well. But yes, it has really helped me. And also, as I'm doing this postgraduate diploma, it's really helping me to expand my knowledge base. And also, I always believe in teamwork. So when one person gets some new knowledge, you then have to act as a mentor to your colleagues, which I'm also trying to do at my hospital. We're also trying to open up our own diabetes clinic for our patients, which hopefully we'll be able to do that post the pandemic, hopefully to end sometime soon. But yes, I've really helped. I learned a lot, and I truly appreciate the opportunity that I've been given. Thank you.
My name is John Manzongo, a photojournalist with the Herald in Zimbabwe, based in Harare. Firstly, I would like to thank our Zimbabwean First Lady, Amai Auxilia Mnangagwa, and Merck Foundation, more than a mother ambassador, for your philanthropic works, and Merck Foundation CEO, Dr. Kelej, for it is through their efforts that our works as journalists get recognition. The Media Award has made an impact on my journalism work as it motivates and make me realize that I can contribute positively to society.
So when Merck Foundation and our First Lady, Mnangagwa, came through with this program. I was quite excited because it gave me more information. There's a training that we attended in Harare where we were taught a number of issues on how to write about infertility, the kind of procedures that people can go through if they're infertile, where to get services, the doctors that have been trained in Zimbabwe, and also issues to do with diet, causes of infertility. You know, I was really empowered by these trainings, and I think as a result of the training, I managed to get an award. I was the first prize winner in the Southern Africa region, and really it made me more confident. It gave me the drive to keep doing this.
Thank you so much for giving me this opportunity, and I'd like to say that infertility is one of the most challenging things that one can go through in life. The random comments that people just throw around when they assume that a woman should be with child cause so much pain and discomfort to many people who are struggling with infertility issues. And one of the things that makes this even more difficult is the culture and the secrecy around infertility issues, and the belief as well that infertility is a woman's issue. And as a result, women cannot share their problems, they cannot share their struggles and the pain that they go through. So that's why initiatives from the Merck Foundation are very important at this time, and they're very effective in the history of the fight against infertility stigma.
So I'm really looking forward to keep working with Merck Foundation to address these issues and bring out that the fact that there can be solutions to these challenges, and also just to encourage people out there to seek the medical attention that is required. With those few words, I just want to thank you, Dr. Kelej, for this opportunity. I want to thank Maya Mnangagwa, who's kept pushing us, even as journalists in the nation, to keep pushing this agenda as we discuss with the various women organizations that are trying to deal with the challenges facing women. I remember watching a video you played, I think on the night of the awards in Ghana, where we saw that woman who was brutally beaten up by her husband. I think she was now left without hands because of those challenges. So these are some of the issues we're also facing here, where people are beaten up, and when they go out there, they are left alone because society doesn't want anything to do with them. So we'll keep pushing and we'll keep going technical, because I think it's a very technical subject, and we'll keep highlighting these issues in our societies. Thank you.
All right. I just want to say thank you so much to Her Excellency Mrs. Mnangagwa, as well as Merck Foundation, for this award. It's truly an honor to be a recipient, of such a prestigious award. It's my first novel, so it's actually quite a great motivator for me to continue writing. I also want to thank God, without whom the inspiration for my writing would not have been possible. As a woman myself, and living in a world full of stigma for different reasons, and especially infertility stigma, I'm truly honored to be able to represent, even in a small way, the people that are struggling with infertility. And from speaking with women in Zimbabwe concerning infertility, especially concerning the condition called endometriosis, most people don't want to talk about it because it makes them uncomfortable, and they don't know how to approach such a topic. But everybody grows up assuming they'll become parents. There's a lot of pressure on women in general, from what I've found, to become mothers, whether they are unmarried or not. And the expectation is that all women must and should become mothers ultimately. I've spoken to women who are struggling with endometriosis, and it's really a sad eye-opener for me on how they view their lives, and how they already feel in most instances that they are not whole, or that they can't truly contribute to society because society views them in a certain way for being different. So I believe that media, as well as education, have a big role to play in sharing information on infertility. And I believe that knowledge starts with the whole family, and teenagers need to learn about these issues, because in a lot of instances, infertility issues start at puberty, and starting the conversation when people are now married, for me, I believe is too late. It should be a community and family commitment, So for me, having said that, I'll continue writing to raise awareness on infertility. That's all I have to say. Thank you so much.
Merck Foundation, for me, the relationship, being an alumni, is really a great thing, because besides the infertility advocacy that I learned, I'm also a cancer activist. So Merck Foundation again is also working in the area of cervical cancer. So I really feel Merck Foundation is really an organization with whom I have fulfilling partnerships going forward. And I'm also now teaching at a university, the Midland State University. So in the coming semester, beginning in August, if we're allowed to open, then I'll also make sure even for the assignment that I give my students, they will also even have something to do around infertility. So I'm really grateful to Merck Foundation for the advocacy that I'm allowed to do on multimedia and the on infertility, and also the issue of cancer, where we are working on cervical cancer. So yes, I'm really grateful to Merck Foundation.
Since our return, we've started at my hospital. We had started at my hospital to integrate my knowledge to the existing clinical services. We were setting up a dedicated specialized fertility clinic, and we're offering mainly diagnostics and low technology fertility treatments. However, the momentum and progress was hampered by the COVID pandemic. As you can note that my return in February 2020 almost coincided with the arrival of the coronavirus in my country. So in the future, we would want to expand the fertility services by increasing not only the number of doctors that are trained in fertility, but also doing probably in-house training of the nurses and other staff to improve their capabilities in working in the fertility unit.
So after the training, I'm looking forward to link up with some of the people that have passed through the Merck Foundation training program, and teaming up and perhaps forming some clinics and providing such services in the government sector. So I'm looking forward to spearhead such a clinic and such a program in the government sector after the completion of the program.
The diploma has changed my view of management of infertility among both males and females. I used to think that it was something out of my reach, and with the majority of Zimbabweans being in rural areas, which is an area where I work. I work at Gwanda Provincial Hospital. I used to think that there was nothing much we could do for individuals presenting with infertility-related problems. However, since embarking on this postgraduate diploma, I've been able to assist couples struggling with infertility, regardless of the cause, either in providing an explanation as to why they're encountering such a challenge, or in providing medical management, which is what we have learned mostly during the course of the diploma.
One of the things that I've been learning and has been of interest in this course is trying to identify the causes, the investigations, and the management of infertility. Like my colleagues who have spoken before me, infertility is one of the biggest challenging problem that can occur to a couple. The psychosocial impact of the problem is far-reaching and devastating in our society, especially to women, and especially because most of the women suffer in silence. So this course has helped me and has given me confidence and also equipped me with the requisite knowledge for me to be able to address the concerns of these women.
So I enrolled in the postgraduate diploma in diabetes, and this is my experience in 2 minutes. I thought the course was very useful in terms of being very practical and clinically oriented. I thought this is very useful to the community in terms of them acquiring, getting the best care from the doctors that have been trained in the latest information. So as we know that there's an explosion of non-communicable diseases, so diabetes is one of them, and this is very, very useful to our diabetes patients.
So I would want to share what this course has done to my career. As you are aware that Zimbabwe is a developing nation, and most places are developing into urban areas, and so this is promoting a sedentary lifestyle, which is one of the risk factors for diabetes. And if you can look at the prevalence of diabetes, it is almost catching up with the prevalence of HIV. And in the rural areas that I am working, the people, they've got limited access to specialist care, because most of the specialists, they are in the capital, and the place that I am is a bit far away from the capital. So some of the patients, they do not even afford to go to see a specialist. So with the knowledge that I've acquired, I'm able to manage some of the cases.
Since I enrolled in the master course, I learned a lot about diabetes, and from screening, diagnosis, management, education, dietary advice, and all, it was like holistic. The knowledge which I had before was mainly on the pharmacological management, but now I can manage diabetes as a whole, from screening up to including education. So at Banget District Hospital, the improvement, my management of inpatients has improved. As Dr. Prince has already alluded, also we have noted that there is decrease in referral to central hospitals. I can now manage some of the conditions, some of the emergencies at our hospital.
Hello, good afternoon.
Afternoon.
Yes, I hope you can hear me. So good afternoon once again, and thank you to Her Excellency the First Lady for this opportunity through the Merck Foundation to be able to do the preventive cardiovascular medicine postgraduate diploma with the University of South Wales. So I'm a public health physician, and I'm into public health policy. So doing this program now, I think has helped me in trying to shape the policy direction for the country. And I'm involved in two projects which are being done by WHO, where we're looking at policy surveillance for NCDs in Zimbabwe. Then also we're trying to start the NCD survey, the STEP survey for Harare. So the input that I'm getting from this preventive cardiovascular medicine program is helping, I think, in shaping those two things so that we improve in the policy direction for NCDs in Zimbabwe. So thank you.
My name is Dr. Mrembwe. I am a doctor who is based in Tare. I largely work in primary healthcare facilities, and I want to thank Merck Foundation and the Office of the First Lady for the opportunity that I got to pursue a diploma in postgraduate diploma in respiratory medicine. In light of the events that happened, in light of COVID that happened, this really came on as a necessary education that I needed. And in my pursuit of that diploma in the past 1 year, I've had an opportunity to interact with people who are practicing elsewhere. I've had an opportunity to identify the gaps that exist within my own system. And of particular concern to me, one thing that I've taken home, or a take-home message, which seems like low-hanging fruit to me, is the issue of pulmonary rehabilitation, which I learned during my 1 year which is about to end in the next 5 days. So I think setting up a pulmonary rehabilitation program within the health system of Zimbabwe is one of the things that I'm going to do following my my postgraduate diploma. And I hope I'll also get an opportunity to do a master's in respiratory medicine so that I can further amplify what I've learned so far. Because during the time that I was learning and going through, you would see that the way that we are doing things and the way the others are doing things, we have several gaps. And one of them in particular pertaining to respiratory medicine is to do with issues of radiology.
Obviously, there is the COVID pandemic, which is predominantly affecting the respiratory system. So knowledge of the respiratory medicine will come in handy. And also the fact that I tend to see artisanal miners presenting with occupational lung diseases. And I think a better understanding of respiratory medicine is going to come in handy in terms of helping to manage these clients well, and also in terms of reducing referrals to the central hospital where they are managed by consultants. Thank you.
Dr.Rasha, of doctors and our alumni and media representative who's the winner. We have 27 winners all these years from media representative and more than 100 doctors. So it's amazing, amazing, amazing. And I'm looking forward to actually take every suggestion and all the success stories to be capitalized on and communicated to all Africa through our social media and through our platforms. So it can show the impact and the great contribution you're doing for society. Thank you very, very much for your precious time, valuable time. And I wish you good luck and success and huge happiness and stay safe and healthy.
All right. Thank you so much, Dr. Rasha. Everyone, thank you so much from the bottom of our hearts. It has been incredible being with everyone. Our appreciation goes out to the First Lady of Zimbabwe and also the Ambassador of Merck Foundation, More Than a Mother, Her Excellency Mrs. Auxilia Mnangagwa.
Dear sister,
thank you. Yes, absolutely. Yes. Thank you to everyone in the media industry who takes part in everything that we do. Thank you so much to all the doctors, the trainees, those who are still training. Thank you. Stay safe, take care of yourselves until we meet again. Bye-bye.
Bye. Bye.